Hi everyone, welcome to Sectoral Events webinar platform. Today is 13th of August and we are based in UK and our UK time around 7 o'clock. As part of the Health Talks webinar series in Sectoral Events, today our guest speaker, Mr. Onur Selcuk Göksel, Prof.Dr Onur Selcuk Göksel, is a tenured professor of cardiac and vascular endovascular surgeon. Welcome, Mr. Göksel.
Hi, good evening.
Good evening. First of all, I would like to say thank you very much. We know you are very busy after lockdown. That's a lot of people get the inquiry during the lockdown and you start a busy schedule with the operations.
That's right.
Yeah, thank you very much. I really appreciate. And today you are our guest and you will talk about many more of your services and the medical area. I'm just going to ask you at the beginning then, could you tell our guests, the attendees, who is Onur Selcuk Göksel, where he is from, where is he based, and your hospital, where do you work?
Sure.
Yeah, and then you can carry on for the presentation. Thank you so much.
Hello, everyone. I'm Dr. Onur Göksel. I'm a tenured professor of cardiovascular surgery based here in Istanbul. I received my medical education both in the States and as well as in Istanbul Cerrahpaşa Medical School in English language. You will see from my presentation my background, the hospitals that I have worked at. I live and work in Istanbul, Turkey right now. I'm currently a tenured professor at Istanbul University, which is a very old and very large university hospital here in Istanbul. Also, we have a franchise chain of hospitals named Acıbadem Healthcare System in Turkey. And I'm currently the director of cardiovascular surgery at Acıbadem Hospital. And I receive a lot of patients all around the world to operate at Acıbadem Hospital.
Acıbadem is the biggest hospital in Turkey at the moment, privately.
That's right, yeah. The biggest and the most luxurious, actually, chain of hospitals.
And very successful.
That's right.
Yeah. Okay, you can take the screen share.
Yeah, sure. Can you see the presentation? Is that okay?
Yeah, that's perfect.
Okay. As I said before, I'm currently a tenured professor of cardiovascular surgery at both Istanbul University Medical Faculty Hospital and also at Acıbadem Healthcare System. I received my medical degree at Cerrahpaşa Medical School in English, which is the oldest and largest medical school in Turkey and one of the most well-known medical schools all over Europe. I did my internship at St. Thomas's Hospital at Cardiac Surgery Department in London, right across Thames. I also worked at Vanderbilt Medical Center in Nashville, Tennessee, in the States. I completed my residency in cardiovascular surgery in Istanbul at Siami Ersek Hospital, which is a very huge specialized hospital, just like Texas Heart or Cleveland Clinic. I also went to John Kirk Cardiac Surgery Center in Italy. I also did my actually worked for a while in Berlin as well. I was a chief resident and became an associate professor at Istanbul Medical Faculty, this very same hospital that I work right now. And I'm a consultant surgeon at Acıbadem Hospital. I go to many branches, like 5 hospitals, and I'm currently the director of cardiovascular surgery at one of the Acıbadem hospitals in Istanbul. I'm an author or co-author of more than 100 articles in respective medical journals. I am the editor and the author of Carotid Artery Surgery textbook, which is a standard right now in Turkey in medical schools. I'm the author of various chapters in many surgical textbooks. I'm the author or co-author of more than 200 medical presentations and lectures all around the world. I'm currently actually a popular speaker. I'm commonly invited for lectures at the Symposium in New York. I'm an invited lecturer in Northwestern Society of Vascular Surgery in the States again. I actually go there twice a year to give lectures. I'm one of the keynote lecturers at Aortic Symposia that is held every year annually in Houston. I'm also, again, an invited lecturer at Cleveland, Abu Dhabi, and Dubai American hospitals in the United Arab Emirates. My areas of expertise are varicosities, venous surgery, and the venous laser ablation techniques, peripheral arterial diseases, limb ischemia, diabetic foot, percutaneous treatment of vascular problems, carotid diseases, aortic diseases, aneurysm treatments, and the vascular interventions. We do a lot of coronary artery bypass and valve surgery as well in adult cardiac patients. We have an extensive international experience in treatment of venous diseases. You can see that attracts a lot of attention from the national and international press. And we receive patients all over Europe. This one is a patient from Netherlands. You can see he was a 50-year-old male. He came to us from Amsterdam, and he had extensive varicosities, and we operated on him. And after that, like 3 days later, he just went back to Netherlands and sent us the picture on the 10th day of the operation. You can see on the right-hand side. And this is another lady that came to us from France, and she had extensive venous ulcers and venous problems. You can see from the upper column. And after the operation, like 10 days again, after the operation, you can see the difference on the legs. And she was an old lady, and she has been having a lot of problems, ulcers and infections, leg infections. Now she's very fine. And we get excellent early cosmetic results with endovenous laser or radiofrequency ablation techniques. You can see here, this is a picture from the day one, and this is, and this patient was a lady with severe venous insufficiency. You can see there's no skin lesions after the operations and no hemorrhages or ecchymosis. This is another happy patient that took a picture of us after the operation again with varicosities. And he called me Mr. Miracle, actually. And smiley faces are actually the best gifts that we receive after the operations from the patients.
Shall we call you Mr. Miracle as well?
Yeah, sure. No, why not?
That's great.
Okay, thanks. And we do a lot of aortic pathologies, diseases from all over Europe, because we have been having these kinds of patients for almost 20 years. And we have been using endovascular technology. My team is actually one of the first operators in Turkey and all over Europe after North America of this kind of technology and the vascular techniques. And we have had extensive experience in both thoracic and abdominal problems. And we actually repair the aortic aneurysms without open surgery. We use the minimal invasive techniques. This is the cover of the book that I wrote about carotid diseases. And these are the examples of the carotid stenosis, narrowing of the carotid arteries on our necks. And we do a lot of percutaneous interventions, opening of lower extremity leg arteries without open surgery with percutaneous angiographic techniques. And these are the examples of our patients that received a lot of attention from the local press and the national press. On the upper left, you can see the first time in the world that we took out a tumor that engulfed the carotid artery and the heart, the heart problems, coronary artery problems.
This was actually in this year, the earlier of the 2020.
Yeah, that's right. The upper left picture was one of the patients that I operated in the first days of this year before the pandemic broke out. And she has been rejected by many surgeons.
The reason for rejection?
She came to us and
the reason for rejection?
Yeah, it was too dangerous, very risky.
Oh, yeah.
Yeah, it was almost impossible to take out the tumor. So, but we just investigated and analyzed the tumor and made a plan about. We actually consulted one of the very famous surgeons in London, and he actually wrote me that he also had never seen that kind of tumor in his professional life, and that kind of it was the first for me too, because I took out many tumors out of neck area, carotid tumors, but this was the first the type of tumor that I saw, this with this big, and also this type of sheath tumor. We call them carotid sheath tumors. Well, we were successful. We were happy, actually.
She's totally fine now, recovered.
Yeah, that's right.
Okay,
that's,
perfect. Thank you.
And we do a lot of live surgeries and satellite lectures, educational stuff, all around the world. And this one was in Arizona, Phoenix, Arizona, like 2 years ago. We performed an endovascular surgery, aortic surgery on one of the American patients, and then attended discussion sections. And I go to many countries like Dubai or Abu Dhabi, and this was another interesting patient that received a lot of local attention from the national press in Dubai. You can see the logo of Cleveland Clinic and the American Hospital on the newspaper page. And we give a lot of lectures, as I told earlier. I'm currently a very popular speaker in many meetings all around the globe. I also served in Turkey as an opinion leader about cardiovascular health, because after the first breakout, we started to observe a lot of cardiovascular problems, more than we normally see because of the pandemic and the COVID infection. And we were one of the first surgical and the cardiac teams that described these kinds of problems in the world, and that received a lot of attention, as you can see that.
Actually, Turkey thrived really well during the pandemic.
That's right.
The case study in the future that how they, they could explain more that how they did succeed.
That's right. That's right. We have been able to manage to control the extensiveness and the severity of the disease, actually. And our team has received a lot of rewards and awards with our work, both in the States, in many countries. The one on the lower left panel is the one that was given to me by the Arab Sheikh. And the reason for that is the team, not just me. Great team, great results we see. Thank you for listening.
So these are the contact details they can.
That's right. These are my email addresses, my Instagram, and my telephone number.
Okay, they can follow you on Instagram. You regularly share your operation information and everything. And also you are happy to have like 15-minute consultation on the phone. If they have any question, they can reach you out to book you on the Zoom session or WhatsApp. Yeah, I can send more details and your contact details by email to the attendees later, so they don't need to copy those pages. If you finish the screen share, yeah, you can.
You can turn it off.
Yeah,
okay.
That's great. Thank you very much.
Thank you.
Yeah, we are getting more people. And as I mentioned earlier, there is a polling part. There are a couple of questions. You can answer them if anyone joined later than my explanation. And also you can write in the chat box or Q&A if you have any questions specifically to Mr. Göksel. Also, you can mention where are you based? You joined from London or other country? I have some question for you.
Yeah.
As many people know, Turkey is doing really well for medical tourism because they have great doctors and lots of successful operations.
Thank you.
Yeah, and also as like yourself, that they've been invited to many countries as a keynote speaker to explain their success. So do you think why Turkey is the best medical destination in the world? So what you, for example, Acıbadem Hospital make difference?
Well, the first, you know, it's going to be a cliche, but the first answer would be hard work. And we actually have been having a lot of experience, maybe more than usual, in many areas of medical profession. So, for instance, I can give you an example. When I finished my completed my residency, I had done or assisted more than 5,000 cardiac operations. Can you believe that? Well, this is much more than any residency that have experience in Europe or in the States even. So that's a lot of work. It means a lot of sleepless nights. So this may be one of the reasons, I'm not sure. But another one is that a lot of doctors here in Turkey, including Acıbadem healthcare system doctors, went to the States or went to the UK or Germany to increase experience, more academic work, scientific work, and extend the areas of expertise within the last 20 years. This actually improved greatly the medical education here in Turkey. Actually, that's what I told on TV actually last week. We have a great culture of medical profession and medical education here in Turkey for more than 200 years. And my medical faculty I'm very proud of, Istanbul Medical Faculty, is the one leading it actually. So the main reason is the discipline and the hard work. And I think we have been analyzing and expecting all kinds of results out of this pandemic by the end of February. So this is very important. So we were actually getting prepared for the pandemic as a country, I mean. That's why we were not very surprised, and we were ready, and we actually have a lot more hospitals in Turkish cities than any other European cities. So this is very important. So we have a lot more intensive care beds. We have a lot more normal beds, hospital beds, more than usually. So this is very important actually for any kind of unexpected health like this epidemic.
Also population, if you compare the population is too big in Turkey. So I think it's enough hospital has been serving during the pandemic. Yeah, that's great.
That's right.
We can't see you properly. If you just like sit back a little bit, then you can see your face properly. And also, I think hospitality is great in Turkey. The medical tourism is not about operation or treatment.
Yes.
It's a whole package, you know.
That's right. In our Acıbadem hospitals, it's like, you know, five-star hotels, you know. They're very comfortable, high-tech, top-notch technology, hospitality, and we have personal assistance for every patient. Can you believe that? For any kind of need that the patient or the patient relative needs, our personal assistant will just aid in, you know, giving them, helping them, whatever they need. And this is very important for the foreign patients that we receive a lot of patients all over the world from Arabic-speaking countries, Russian-speaking countries, English-speaking countries, French-speaking countries, and we have translators for each of them. And this is very important. They have no problem in communicating with their healthcare staff. So this is very important, as well as hospitality, I think, with the top-notch technology.
On first stage, how they reach you or your team together?
They can email me. They can reach me through Instagram. They can email me. They can call me. They can write my assistant from WhatsApp. Whatever way they prefer, they can reach me quite easily.
Okay, it's better to communicate with you first than hospital, probably, because it depends on which hospital you are going to operate.
Yeah, you know, it depends on the preference of the patient and what they need and what they expect, as well as the price range, maybe, and the type of operations that I will offer them, maybe more minimal invasive than normal, and they can be more comfortable. And that's why they had better contact me first and reach me directly.
This is great opportunity. If you say that there are the different price range, then, you know, you can suggest them which hospital and what type treatment they will get, but it's going to be from you anyway.
Yes, it's important because some operations you need more luxurious stay, because if you're gonna stay like 5 days, you would like a better, you know, a larger hospital with more facilities. But if you're gonna stay for just one night at the hospital, then it's not very important to have that operation maybe in a 1,000 bed facility. So that's why, depending on the problem and the type of surgery that we're going to offer to the patient, we will give the best choice that we think, and the price range, and it's up to them. They can decide.
And how long they need for each type of operation that you explain in the presentation, if you can give us the example?
Yeah, sure. We usually for venous surgery or varicosities, we either perform the same day discharge. That means we operate in the morning or during noontime, and we discharge the patient in the afternoon or in the evening, or we ask the patient to stay in the hospital overnight in case any pain or any problem can occur. And that's just one night for venous surgery. And if you're talking about coronary artery bypass, that can extend up to like 1 week or 10 days sometimes. But the usual discharge time for the coronary bypass surgery is like 5 to 6 days. And other types of surgery, it depends. For like carotid surgery, we discharge the patients in 1 day or 2 days. And for endovascular procedures, we discharge the patients the day after the surgery. So it all depends the type of surgery and the extensiveness of the disease.
So you give average days from your experience, then
That's right.
maybe it's better for them not to buy return tickets at the beginning, just in case.
Yes.
Yeah. Also, after care, after the operation, how do you follow?
You know,
are they going to visit you again to Turkey, or you follow online?
Well, it depends on the type of disease. You know, for varicosities venous surgery, they can, just like the patient from Netherlands or France, they can just send us the pictures, or we can do a video conference call for the follow-up. Sometimes for cardiac patients, we ask them to come back in 6 months or 1 year later, but it depends on the patient and type of surgery. Sometimes the patient is very, fit and very healthy. We just ask them to go to their local doctor or family practitioner. That's it. It means sometimes it's enough. And sometimes we think that it's better for the patients to come back in 1 year. We ask them to come back in 1 year if they want to.
We have some question in Q&A box. If you can read it, or shall I read for you? It's Dider Colleen. He says, what was the Dr. Göksel opinion about the following nitric oxide and vitamin D3 is almost a key to everything in preventing chronic illness. Great for cardiovascular system. Without it, your ratios of oxygen and CO2 would go in wrong direction. Nitric oxide opens up the cell to receive what they are taking. Often what happens, you can take great supplements from the great sources, but if they are not bioavailable, if the cell is not open through the capillary wall because of not enough NO, you are not going to get the absorption.
I have read all the questions that Didier has. I can start from the last one. Sleep apnea is a severe problem. Severe problem that can cause cardiovascular problems, particularly sudden cardiac death, which is a very severe clinical situation. So sleep apnea should be treated, definitely. Secondly, taking statins to reduce cholesterol. If your cholesterol levels are high and your diet change and the lifestyle change does not help, if they do not help, then you better take the statins. But we give to the statins to the patients not only to reduce cholesterol levels, but they also have additional benefits for the cardiovascular patient. What they do, they stabilize the atherosclerotic plaques within the cardiovascular system, like coronary artery plaques or carotid artery plaques. So we give statins not just to reduce cholesterol, but also stabilize the vascular wall, reduce the type of inflammation that occur in the vascular wall. So we give cholesterol. This discussion, I know, Didier, has gone to a wrong direction. It's not just about reduction of cholesterol levels. And your first question, nitric oxide is a very important compound within the body. It regulates the diameter, the caliber of the blood vessels, as well as the response of the intimal, that is the innermost section of the vascular wall, intimal part of response of the intimal part of the vascular wall to any kind of physical or chemical stress. And an example to that kind of stress is hypertension. So it is very important, but it should be produced, synthesized within the body. So it must be endogenous nitric oxide. So vitamin D is an important antioxidant that can stabilize the vascular wall for chronic cardiovascular problems. But it can also, getting too much vitamin D can also cause problems within the body. So it's all about balance, you know. If you can keep the balance, it's good to get adjunctive vitamin D. So it is good, but you have to keep the balance.
Okay. If you have additional question, if you would like me to mute your speaker microphone, please let me know rather than to type in the chat box.
Okay, well, I saw another question from Didier.
Yeah, I think he has.
Yeah, that's right. The amount of nitric oxide production can reduce with age, but it is still important to keep that level adequate if you can do adequate amount of exercise. You know, exercise is the best answer to most of the cardiovascular problems. Avoidance from inactivity, of course, with the tobacco products as well.
Okay. Are you going to carry on to ask more questions, or is that fine?
You're welcome, no problem, Didier.
Okay, I think it's fine. I have additional question.
Yeah, sure.
You say that you are going to other countries for the speech. So when you travel to abroad and when the people reach you based on each countries that you travel, do you have any special hospital that you can see the patient? For example, if you travel to London, how they can find you and how you can see them and to suggest or
Sure,
have a
they
first
can just,
consultation? Yeah.
what they can do is just, they can contact me beforehand about the dates that I will visit London or the rest of the UK, and they can come, we can make a reservation and we can make an appointment. They can come to my hotel because I do not work with a clinic or hospital in the UK, and that's why I can't, but we can talk about their problems. I can just give a quick physical, and I can give my recommendations if appropriate, medical ethical, if they choose to come to me for treatment, so we can just go on with the treatment.
Okay, great. But I think now everyone online, they can also reach you on the FaceTime or
yeah, sure. They
Zoom
can just call me,
yeah.
write to me, follow me on Instagram.
You have specific medical tourism team that they can able to pick them up from airport and to, you know, organize the hotel
that's
where
right.
they are going to stay and a whole package.
I have assistants that can arrange everything for them, and we can give our patients the details they will need if they choose to come to Turkey.
Okay.
And Acıbadem Hospital Healthcare System also, we have also the whole you know, engagements with the hotels and everything, are you know, cars and everything they can pick up from the airport. It's all set, no problem with that.
They have specific team.
Yeah.
Great. Also about the insurance, I know Acıbadem in part of the international insurance companies list as a great hospital, but depends on the operation, I guess, that if they cannot wait too long in UK to get the operation, probably you can serve in person but it's going to be included their insurance. Did you get this kind of inquiry before?
Actually, we accept most of the international insurance companies like Allianz or Sigma or any other Mafre, any other international insurance companies. I don't think that would be a problem.
Okay, great. Any other question? Let me check the box again. Yes, Sarmin Aksoy, how can we reach Dr. Onur if we would like to get a consultation? Yes, I think you joined late, Sharmin. I'm going to send you an email. Each of the attendees included his details. Also, he's happy to give 15-minute consultation online. So I will send you these details. Also, you said, my husband has a heart disease and is suffering from pancreatic inflammation for a few months, but we were unable to reach a specialist. Are you gonna?
Yes.
Yeah, you can.
Mrs. Aksoy's husband has a heart disease and also suffering from pancreatitis. First of his pancreatitis should be treated. Then after that, if the heart disease is stable, we can go on with the cardiac status, what we can do about it. Of course, there are a textbook of heart diseases. We have to know what kind of an extensive of the heart disease, but my guess is a coronary heart disease. If the pancreatitis is set, then after that we can go with the coronary, if that's the situation, coronary artery diseases. For Didier, yes, we accept BUPA.
Yeah, I also gave the permission. If you want, you can ask question. He took the permission to speak.
Just for note, for insurance companies like BUPA, we get provisional approval from the insurance companies for the operations that we will do. If they accept, they give the provisional approval, we go on with the operation.
Okay, great. Dieter, do you have any more questions? I allow you to talk.
You're welcome, no problem.
Okay, so I'm Didier's wife. I'm asking you all the questions, by the way.
Okay, that's great.
I just want to ask, because I asked about this nitric oxide, and you said that it's better to exercise, but is it still a good idea to get the supplements, even if you do exercise?
Well, that is something that I think Mr. Colin, does he have a pulmonary hypertension?
No. It's about my sister. My sister has got cancer, and they said this nitric oxide is good for cancer patients as well, because it gives oxygen to the cells.
Well, actually, it is not about oxygen. It's about anti-inflammation. Any cancerous cell, any cancerous formation produces a type of inflammation around it, destroying the nearby normal cells. So nitric oxide is a regulator of the inflammatory reactions. So that's why they give the nitric oxide to those kinds of patients. So my best advice should be for you to follow your physician's recommendations. I don't think that would be too incorrect to say that any kind of supplements should help your sister.
Okay, thank you very much.
You're welcome, no problem.
Thank you for the questions. If you don't have any more questions, I think no.
Thank you.
Okay. So, Mr. Göksel, would you like to add anything? That I think
Yeah, that's all.
That's all.
That covers it, I think.
Okay. Thank you so much for
Thank you.
all the information. It was great. And if they would like to know more about the technical inquiries, that I will send them the email and include your contact details and your team WhatsApp numbers and everything. The better, as you say, the better they can reach you first, and then you can suggest which hospital they are going to.
That's right. I'll be more than happy to help.
Great. Thank you so much. I hope people got their answer, and have a lovely day. All the success for you. Thank you so much again.
Have a good night.
With us tonight. Have a lovely evening. Bye, everyone.